To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hey everybody, and welcome to Your Health. Well, today we're going to talk about updates in colon cancer. To help us through that is Dr. Tim Edison from Surgical Associates of Neenah. Welcome, doctor.
Thank you,
Okay,
Brian.
so let's just start with an overview of colon cancer. How common is it, and in who?
Sadly, it's very common. It is the second most common cancer in women worldwide, third most common cancer in men.
Now, how does that relate to what we're seeing in Wisconsin?
Well, in Wisconsin, about 2,500 people every year are diagnosed with colon cancer.
And is that higher than the national average?
Well, I did some fact checking, and actually we're slightly lower.
Oh, well, that's great. So continue to eat that meat and cheese and we're okay.
We'll get to that later.
Yeah, all right. So let's talk about screening, because there has been some updates on when to screen.
Big news this year, and appropriate for March and Colon Cancer Awareness Month, but the new age of screening is now 45 instead of 50, which is a wonderful thing.
Get people in there sooner,
Yes.
and that must be because it's becoming so common, right?
True. Now, even though the good news around here is that colon cancer incidence is lower, the bad news is, the concerning news, is that colon cancer for people under 50 is actually increasing. And that's why it's such a good thing that we're doing these screenings in people under 50. This is the way we can catch those small, benign polyps. Remember, Brian, that all colon cancer begins as a small, benign growth known as a polyp. During colonoscopy, we can so easily remove that polyp and prevent colon cancer.
So, well, that's great to get it early, get those benign things taken care of. We talked about diet. What are some things we can do to avoid that risk?
Well, it has been shown that a diet that's high in fruits and vegetables is colon cancer preventative, or at least in preventing polyps, which are the precursors for cancer. Also, certain supplements like calcium, magnesium, vitamin D, and vitamin B6 have been shown to be helpful. And happily, for those of us who love Italian food, garlic in the diet has been shown to slightly decrease the risk.
Garlic is the miracle for everything, isn't it?
Yes, it is.
Well, so what did we learn today? We learned that colon cancer is very common, right?
Yes.
It's important to get screened early, and that new is 45, not 50,
Exactly.
and then a good diet.
Perfect.
Well, doctor, I want to thank you for all the good tips and the good information, and we want to thank you for watching To Your Health.
The preceding was a paid advertisement.